Alaikum. The article for this week was titled as 4-year pulp survival in a randomized trial on direct pulp capping, done by Ballal and others along with the Zender, published in 2023 in Journal of Endodontics. Direct pulp capping of caries exposure has shown low long-term success rate in classic studies, with cases continuously failing over the years. However, recent studies reported a higher success rate, but they focused on short-term clinical success after 1 year. Two of the main factors that have been suspected to improve the outcome of vital pulp treatment are the use of calcium silicate cement instead of calcium hydroxide, and proper wound management using a sodium hypochlorite solution for the lavage of the exposed site. A reason why direct pulp capping of caries exposure is avoided by practitioners is the fact that the treatment can fail painfully, causing unbearable pain to the patient. This study aims to analyze the effect of randomized washing step on pulp survival up to 4 years, also to assess the occurrence of painful versus non-painful treatment failures over the time, and finally to monitor the correlation of matrix metalloproteinase 9 levels on these events. Patients were included are systematically healthy, presenting with caries penetrating the entire thickness of the dentin with pulp exposure that unavoidable after complete excavation in an adult posterior tooth, molar or premolar, with no periodontal pocket and no spontaneous pain, and the tooth had to be response to cold test within normal limits, and only teeth that did not show any apical rarefaction on the periapical radiograph. So 96 patients were allocated to this study and divided randomly into two groups based on the solution used for the lavage of the exposure site, either saline or 2.5% sodium hypochlorite. 48 for each group. 14 patients were lost in the saline group and 9 patients were lost in the sodium hypochlorite group during the follow-up period, and they ended up with the 34 for the saline group and 39 for the sodium hypochlorite group for analysis. After removing the caries lesion, the bleeding from the exposed pulp was controlled by pressing a cotton pellet socket in sterile physiological saline for 1 minute. Then the pulpal fluid was then collected by using paper point for the protein analysis. The exposure was treated for another 30 seconds using the allocated solution, either saline or sodium hypochlorite, and the cavity was then flushed with the saline solution for 10 seconds. They used MTA and followed by a glass enomer and final restoration with composite filling. The level of MBP9 were measured using ELISA kit, and patients were recalled after at least 1 year and then 3 years up to 4 years. Treatment success was defined as normal reaction of the patient to cold test on the treated tooth, no spontaneous pain, no tenderness to percussion, absence of sensitivity, healthy soft tissue, and no rarefaction on the periapical radiograph at the recall visit. Any form of symptomatic pulpitis or apical periodontitis was considered a treatment failure. Asymptomatic apical periodontitis, also the loss of response to the cold test and or the developmental of periapical rarefaction. This was also considered a treatment failure. For further analysis, failures were subdivided into painful or non-painful, and any treatment failure that called for an emergency root canal treatment was listed as a painful failure, and non-painful failure were confirmed at the first 1 year and second 3 to 4 years recall visit, and days to failure were recorded. Moving to the result, the recall rate was 73%. There was one restorative failure, which is a fracture cusp in a tooth with continued pulp survival, and the number of clinically confirmed painful symptomatic pulpitis or apical periodontitis and non-painful asymptomatic apical periodontitis failure were 18 and 11 out of 34 followed cases treated with saline, and 3 and 6 out of 39 followed cases treated with sodium hypochlorite. The proportion of painful versus non-painful failures was 62 for the saline group and 33 for the sodium hypochlorite group. Kaplan-Meier curve estimate for pulp survivor showing pulp survivor up to 4 years. It was 7% for the saline treatment and 55% for the 2.5% of sodium hypochlorite treatment. High matrix metalloproteinase 9 level were associated with early and painful failure, especially in the saline group, and later failure were mostly non-painful. So to conclude that this randomized trial suggests a beneficial and sustained effect of pulp lavage with sodium hypochlorite over control treatment with saline solution on pulp survival in non-painful adult teeth with caries close to the pulp. Treated by direct pulp capping with MTA, sodium hypochlorite lavage did not only increase survival of affected pulp up to 4 years, but particularly diminished painful failure to 33% compared to the saline group, which was 62%, and high matrix metalloproteinase 9 values in pulpal fluid collected from the exposed site did not seem to be associated with failure that occurred more than 8 months after intervention.